Hello, this is Dr. Groover. I'd like to talk to you a little bit about a type of injury that we see really regularly in our clinic, and that is a repetitive stress injury. And a repetitive stress injury is an injury to your muscle, your nerve, or your joint that's usually caused by repetitive stress. Now, repetitive stress is something like a swinging of a golf club over and over, or swinging a tennis racket over and over again. With the golf club type repetitive stress, you'll get a pain on the inside of the elbow called golfer's elbow, and with the tennis racket, you'll get a pain on the outside of the elbow called tennis elbow. There's also a condition called carpal tunnel syndrome, which is basically the overuse of the wrists and the stress that occurs closing down or clamping down on the median nerve that supplies the thumb and the first 1.5 fingers or 2 fingers of your hand. There are other injuries that come about by playing, for instance, video games called gamer's thumb. There's also BlackBerry thumb or iPod thumb, or there's a Rubik's Cube thumb that comes about from playing with the Rubik's Cube too much. There's a raver's wrist that comes about when people go to raves and they wave a light stick around all night long. Another source of repetitive stress injury is forceful exertions like pitching, throwing 100 miles an hour all night, and sometimes the pitcher will throw out their arm or their shoulder. There's weightlifting. Weightlifting, for instance, bench pressing and having so much weight that you can't really stabilize your shoulder, and the arm gets pushed onto the backside of the shoulder socket and gets stuck in that position. There's vibration injuries that occur from repetitive stress. We had a man visit here that was a worker on the railroad, and he spent a lot of time on freight trains with lots of vibration. He ended up with some serious low back injuries. There are mechanical compression type repetitive stress injuries, such as ladies wearing beautiful high heel shoes that squeeze their toes together and misalign their foot and their toes and can give them bunions. There's sustained and awkward positions. A sustained position is like talking with your phone on your shoulder, or sleeping face down or belly down with your face twisted over to the side. There's a lot of stress on the spinal joints when you do that. A sustained awkward position also would involve looking down all the time, hunched over a desk, studying or working on assignments or working as an adult. So sleeping with your head forward, in other words, lying back on a bed with thick pillows and having your head pushed in a forward position and having your spinal joints getting stuck in that position. Now, treatments for these kinds of conditions usually include, in the medical model, include things like anti-inflammatory drugs and braces and splints, and basically trying to immobilize and rest the joint and give it a chance to recover. Another way of dealing with this is to eliminate the activity altogether, or suspend the activity altogether, or modify how you do the activity so you don't get those types of injuries. Now, one of the areas that we see that's sorely missing in the treatment of repetitive stress injury is just the diagnosis and treatment of the joint misalignments that go along with these injuries. Now, in chiropractic, we're very skilled at diagnosing spinal joint misalignments and repositioning those joints to take the stress off the joint and allow the injury to heal. We also treat these injuries using very specific therapeutic exercise to help strengthen the muscles and balance the muscles to prevent the spine or your extremity joints from being misaligned chronically or misaligning easily. Now, in this article that is associated with this video, It's published on my e-zine. You can find it by going to www.grooverclinic.com. Groover is just like groovy with a ER at the end. You go there and you can find that article pertaining to being crunched forward in a C position from riding in a sports car bucket seat. And my wife and I did that for 6 days this summer down in my home state of Florida. And we spent a lot of time having fun there, but the long rides with the vibrations associated with the rides actually took quite a toll on Karen's spinal joints and her hip joints. And it took about 2 months of regular care to get that all cleared out and get her back to normal. So even something as simple as sitting in a car seat can really injure you severely. So my advice is to avoid repetitive stress injuries, and if you have been exposed to repetitive stress and you think that you want to avoid future complications from any kind of injuries that may have occurred there, even before symptoms appear, symptoms of stiffness or pain, even before they appear, go and have your joints checked out by a qualified person who can effectively diagnose and treat these things and have them eliminated before they become symptomatic repetitive stress injuries. So, best of health and wellness.